Now, when seconds count, 1 in 5, about 20% of us adults will make a trip to the emergency department within the next year. For children, though, the rate is higher, 1 in 4, 25%. ERs are equipped and ready to handle us grown-ups, but a new study found the majority are not fully prepared to meet the needs of pediatric patients. Our national investigative reporter Heather Graff talks to the doctors behind this research and shows you why they say an affordable and life-saving solution already exists.
My daughter Rebecca Ava was born July 13, 2006.
When Phyllis Rabinowitz took her baby girl home from the hospital, she had no idea her family's joy would be fleeting.
She was not feeding well, she was not breathing well.
Symptoms that prompted a panicked trip to the emergency room. But Phyllis says doctors in the ER sent her daughter back home.
They thought it was a common cold.
And just a few days later, Rebecca was gone.
At 9 days old.
Phyllis says an autopsy later revealed Rebecca had died from a viral infection that went undiagnosed in the ER and therefore untreated.
We quickly learned that many emergency rooms aren't prepared for children. It's causing deaths.
Are children dying unnecessarily because of this?
The answer is yes.
It's a phenomenon Dr. Nathan Cooperman has been researching for years. He's the chief academic officer at Children's National Hospital in Washington, D.C., and says the National Pediatric Readiness Project evaluates ERs on criteria that include the availability of child-size equipment, along with pediatric-specific protocols and training. High pediatric readiness defined as scoring at least 88 out of 100 on that assessment.
I don't want parents to panic, but this is important.
Cooperman's latest study, in partnership with Dr. Craig Newgard of Oregon Health and Science University, analyzed data from nearly 5,000 emergency departments nationwide and found just 17% had that high level of readiness. Researchers also used predictive models to determine what it would take to bridge that gap. And this map illustrates what Cooperman considers to be eye-opening results. The estimated annual cost to reach universal high pediatric readiness ranges from just $0 to $12 per child, depending on the state, for a total of about $207 million each year to cover every ER in the U.S.
It's affordable. Very affordable.
To better understand how it's so affordable, he points to this checklist that provides critical but cost-effective ways to improve an ER's pediatric readiness score.
One of the most important things is what we call a pediatric emergency care coordinator. That is, having somebody in every emergency department whose job is just to make sure that you have the protocols in place, you have all the equipment necessary.
This color-coded pediatric cart, perhaps one of the simplest recommendations.
We open a drawer and the specific equipment is there already, and we can just do our job.
So as some hospitals work to make improvements on their own, Cooperman hopes policymakers are also compelled to help.
This is a roadmap for legislators to say, hey, in your state, you can do this by investing this amount per year.
And until then, Phyllis Rabinowitz says she'll keep sharing Rebecca's story.
There are children dying each day in emergency rooms, so let's do this. Let's do this now. We can.